Hello and welcome to this presentation on pay equity and the community caregiving sector. My name is Tina Poirier and I'm the project coordinator with the New Brunswick Coalition for Pay Equity. So let's get started. So in this video, you'll learn what equitable wages should be in the community caregiving sector for 6 services. Let's start with a quick outline of the session. So first of all, I'll explain to you what we do with the coalition. Then I'll talk about the Valuing Caregiving Work project. After that, I'll explain what pay equity is. Then I'll share our pay equity results. And finally, our recommendations to government. So the New Brunswick Coalition for Pay Equity is a non-for-profit that advocates for pay equity and fair working conditions. It was founded in 2001. And it has 100 member organizations as well as over 1,000 individual members. The project that we've been working on since 2018 is entitled Valuing Jobs in the Community Care Sector. It has 3 parts: education, job evaluations, and advocacy. So when I talk about education, I mean not only educating the public at large as to what type of work is being done in the community care sector, but also information about pay equity and how it affects the sector. It's also about educating the sector itself, the employees and employers in the sector that would like to know more about pay equity and how pay inequity affects their sector. The second part are the job evaluations, and these were done with committees made up of employees and employers of the community caregiving sector. So the third point is advocacy. So the coalition will be using the results of the pay equity analysis as yet another tool to advocate for public investments in the community care sector to improve work conditions, obtain better salaries, and eventually to have pay equity in the sector. Now, 6 services were covered by this project: special care homes, ESSP agencies, which are employment and support services programs, family support services for adults and children, home support services, community residences for adults and children, and also transition houses for women fleeing violence. Now, before I get into the details of these 6 services, I wanted to share just a quick overview of some key stats of the community caregiving sector. And now we're only looking at the 6 services that I just showed in the previous slide. So in the care sector for these 6 services, there are approximately 11,000 workers. 95% of them are women. This represents about 650 agencies. The wages vary from 14 to 17 an hour. And there is currently no pay equity legislation for the private sector, so no pay equity legislation that covers the community caregiving sector. So the first service of 6 are special care homes, and these homes provide services to adults and seniors. They provide long-term care of levels 1, 2, 3B, and 3G. The workers offer personal care, help with social activities, and medication management. And these services are offered 24 hours per day as the residents live in these special care homes. Now, ESSP agencies, employment and support services programs, are agencies that offer employment-oriented services and supervision to adults with disabilities. Now, these disabilities can be mental health issues or intellectual, cognitive, developmental, or physical handicap. The goal is to help these individuals maximize their social, community, and economic independence. Family support for adults. Now, family support workers offer monitoring services and/or accompaniment to adults between the ages of 18 and 64 that live at home. So they're functional, they can live at home, but with help with certain aspects of daily living. These individuals either have mental health issues or an intellectual, cognitive, developmental, or physical handicap. And the goal is to help these clients, these individuals, reach an optimal degree or work towards an optimal degree of personal functioning and autonomy. So we also have family support services for youth, so different clientele. Sometimes these are child protection cases, so they can be court appointed. In this case, the service isn't always requested by the family, which adds a layer of complexity. In certain cases, the family may have a child or children with a handicap and they need extra assistance. In every case, though, the child or children either have a particular emotional, social, behavioral, developmental, and or medical need. And essentially, these family support workers, like I said, they help children, but also families, because there's a whole family dynamic surrounding the child. And of course, help is also offered to new parents. Now, home support services are offered to children, adults, and seniors living in their own homes. It can be a long-term care or part of a disability support program. What's offered is personal care, help with activities of daily living, and also home management. Now, community residences for adults and children, care and supervision is provided for both children and adults with disabilities. So either physical or mental health conditions, and these needs are higher care needs. And they're also offered 24 hours per day because the residents live in the community residence. Now, the last service are transition houses, and these offer services to women and children victims of relationship violence or abuse. What is provided is crisis intervention and safety planning. Also, shelter is offered for 30 days or more, depending on individual needs. And it's 24-hour support and care. Okay, so now I'm ready to talk about pay equity. So exactly what is pay equity? The first thing about pay equity is to make an important distinction. There is a difference between equal pay or pay parity and pay equity. Not the same thing, and they often get confused. So when we talk about equal pay or pay parity, we're talking about equal pay for equal work. That's why we're using the comparing apples with apples analogy. In this case, it would be, for example, comparing a female nurse with a male nurse. They have the same job. If they have the same level of experience, the same qualifications, they should be getting the same wage. So when we talk about pay equity, we're talking about equal pay for work of equal value. So that's why in this case, we're using the comparing apples with comparing oranges analogy. Because with pay equity, we need to compare jobs mostly done by women to jobs mostly done by men. So female-dominated jobs compared to male-dominated jobs. For this example, the apple, which represents the female-dominated job, could be a secretary, whereas the orange, which represents a male-dominated job, could be a mechanic. Very different jobs, but they can be compared using very specific factors that I'll explain in upcoming slides. So when we talk about a pay equity process, we have to consider some main components. This is not the full list, but the most important aspects of the pay equity process are on the slide. First of all, during our project, we had committees of employees and employers from the community caregiving sector that represented the 6 services that we looked at previously. Number 2, you need job descriptions. The job descriptions were developed and validated by these committees of employees and employers. Also, we contacted various key people within the sector and also used a key documentation. Number 3, you need to do job evaluations. It's at the heart of the pay equity process, and these were done by our committees using the job descriptions and other tools. Number 4, you need to compare job class values. So in this case, for pay equity process, you need to compare female-dominated jobs, so jobs in the community caregiving sector, to male-dominated jobs. And I'll talk about those male comparators a little later on. Number 5, the goal is to calculate fair wages. So in this case, it's the equitable wages for the 6 services that I mentioned earlier. So now, job evaluations. We can dive a little bit deeper and I'll explain how we go about doing a job evaluation. But before we get to these details, I just wanted to share this iceberg analogy that applies well to the care sector, explaining that the value of care is not just about kindness. You have to dive deeper and think about all the skills that are required to do this job or these jobs. The types of effort, the level of effort, the working conditions that one has to deal with, and also the types and levels of responsibilities. So a few examples here. One would require in this field excellent communication and cooperation skills. They have to deal with unpleasant and even hazardous environmental conditions. Employees need a high level of concentration and professionalism. There's an important physical and intellectual effort that's involved, and also training is required, experience, and a whole lot more. So how do we evaluate female-dominated jobs with male-dominated jobs, comparing apples and oranges? So in this case, the female-dominated jobs are the jobs of the 6 services, as I mentioned before. And we'll look at the male-dominated jobs in the upcoming slides. So these 4 factors here, we just saw in the iceberg diagram earlier. So you have 4 factors. You have the qualifications needed to do the job. You have the responsibilities. You have the effort that's involved, and as well, the working conditions that one has to deal with. So each of these factors can be broken down into sub-factors. So it's just to further explain or detail what we mean by each of these factors. And it's based on these sub-factors that we can evaluate jobs, because our committees of employees and employers actually attributed a value for each of the jobs for each of these sub-factors. So when we talk about qualifications, we're talking about the education that's needed, the education level to do the job, the level of experience that's required, and also the level of dexterity and coordination. So fine and also gross motor skills. Now, when we're talking about responsibilities that are involved in any given job, we're talking about the level of and importance of decision-making, accountability, the importance of communication and interpersonal relations, and also of staff supervision. So when we talk about responsibilities, we also have to look at staff supervision. Although for the female-dominated jobs in this sector, it's not a very important sub-factor, but it's still part of the pay equity process, and we need to look at it as well. So the third factor is the level of effort. So when we talk about effort, we're talking about intellectual effort, the level of concentration and sensory attention, and also physical effort. And when we talk about physical effort, it's not only lifting and transferring weights, but it's also how long you have to stand up for, how long you have to sit down, do you have to do many repetitive tasks, repetitive movements. And as for working conditions, we're talking about unpleasant or hazardous environmental conditions. So this can be anything from shift work, working nights, working in a very loud environment, stressful environment, being exposed to certain chemicals, etc. Okay, so now I'll explain more how we do compare female and male dominated jobs. How does it work? So here I'll start with an example of a municipality that looked at different jobs within its workforce. So in the first column here, you have all the different jobs. Second column, the gender predominance. So is it mostly done by men or mostly done by women? And here you have the value of each of these jobs. So when I mentioned earlier the 10 sub-factors, that's what is used during a job evaluation and pay equity process to attribute a value to a job. So all of these numbers here for each of the jobs, it represents the total value when you add up all of the 10 sub-factors. And when you have a value, you can then calculate a wage. It's a long series of calculations that we won't get into today, but it's just to get you started with understanding the process. So just a few examples here. The maintenance worker is usually a male-dominated job. In this case, they received 162 points when the 10 sub-factors were added. And this equates to $21.98 for an equitable wage. So another example is the pay clerk. In this case, it's a female-dominated job, and the total value is 285. So this amounts to $27.49 as the equitable wage. So here it's just to show you that basically the higher the value, the higher the points, the higher the equitable wage. Okay, so now let's look at the male comparators. The challenge that we have with the caregiving sector is that it is a female-dominated sector. So there are no male-dominated jobs, no male comparators. So what we did to do our job evaluations, the pay equity process, we followed the method used by Quebec. Quebec does have pay equity legislation for the private sector. So the 2 comparators that they used for their own pay equity process was the maintenance worker and the foreman. So these 2 jobs are generic and found in most workplaces. So when we talk about the maintenance worker, another word would be janitor. So the foreman in this case would be a director of operations. So the person responsible for building maintenance, the installations, the perimeter. So it wouldn't be the person responsible for directly overseeing the caregiving services. So I just wanted to specify that. So what we have here on the right-hand side are the job values that were assigned to all of the female-dominated jobs, and also the two male comparators that you have here in gray at the top, the maintenance worker, and the foreman at the bottom here. So as you can see, the maintenance worker received 388 points in total. So that would be the value of the job in points, once you add up all of the 10 subfactors. Now the foreman received 745 points. So that would be the total of the 10 subfactors. All of the female-dominated jobs fall somewhere in between the two male comparators based on the points that they received for the 10 subfactors that I explained earlier. So home support workers received 570 points, as well as the special care home workers. ESSP, Employment and Support Services workers, received 639. Family support workers that care to adults, same, 639. Crisis interveners for transition houses received 673 points. Direct caregivers for adults that work in community residences received 677, as well as those that mainly service children, so 677. As for the family support workers that provide services to children, they obtained 681. So here I'll be going back to the male comparators that we just looked at, but adding this time the equitable wage that is attached to each of these comparators. So how did we arrive at this equitable wage? So this information comes from Statistics Canada. We also enlisted the help of an economics expert. And based on her findings, the equitable wage in New Brunswick, the average equitable wage for maintenance workers is $16.75 an hour. So some might make less, some might make more, but that is the average wage. As for the foreman, the way that we came up with this figure here for an equitable wage, the $27.92, is that based on, again, the method used by Quebec, a maintenance worker should make 60% of what the foreman makes. So based on a series of calculations, this amounts to $27.92 an hour. And it's important here to talk about the wages of the male comparators because it's based on these wages that we can calculate the equitable wages for the female-dominated jobs. Now it's time for the results. It's probably what you've been waiting for. So let's look at them. Here we have the same jobs that I showed a few slides back, also the points that I also went through, but this time we're adding the fair wage that was calculated for each of these jobs, and the fair wage was calculated based on the point value. So again, here there's a series of calculations that we won't be going too much into detail for this presentation. So here, as I mentioned earlier, the maintenance worker is fair wage is at $16.75. The foreman here, the second male comparator, the fair wage is at $27.92. And all of the female dominated jobs fall in between. So home support workers, if they were making an equitable wage today, it would be $22.44. Special care home workers, the same thing. ESSP workers, an equitable wage today would be $24.60. Same thing for family support workers that service adults. Crisis interveners, it would be $25.67. Direct caregivers for adults and children that work in community residences, an equitable wage would be $25.79. And the last service, family support workers for children, an equitable wage for them today in New Brunswick would be $25.91 an hour. Now, just to specify that the fair wage here is what an employee would achieve at the top of the wage scale. So right here, we have all of the same female dominated jobs in the first column we have the fair wage that I just shared with you in the previous slide. And here we have the current entry level wage for all of these jobs. And the last column is how much, catching up that we have to do to make up for the difference between the current entry level wage and the actual equitable wage that was calculated by our committees of employees and employers in this sector. So if we look at home support workers, I mentioned the equitable wage would be $22.44 today. Current entry level wage is $15.50. So there's a difference of almost $7. So there would need to be an increase of $7 per hour. Special care home workers, same equitable wage that was calculated. Their current entry level wage is $14.50. So here a difference of almost $8. ESSP workers, $24.60 for the equitable wage. Current entry level wage is $16.64, so a difference again of almost $8. Family support workers for adults, $24.60. Current wage is $16.80, current entry level wage. So a difference again of almost $8. Crisis interveners working in transition houses, $25.67, the calculated equitable wage. They're currently making $13.55, so a big difference here, even more so than the other services, a little over $12 an hour. Now, direct caregivers for adults and children that work in community residences, their current wage is $16.80, so a difference of almost $9 here if they were to reach pay equity. And the last service, family support workers that service children, the current entry level wage is $16.80. So compared to what they should be making if they were to receive an equitable wage, a difference of a little over $9. So here, I wanted to share with you the same result that we've just seen in the various tables, but visually represented in another way, because sometimes it helps to see the results in a different format. So here, the first thing I'd like you to take a look at is the horizontal axis. So this represents the total points assigned for each of the jobs. Remember that I had mentioned that all of the TED subfactors, when they're evaluated and when we add them up, it gives a total point value for each of the jobs. So based on the points, you can calculate the equitable wage. So the vertical axis here are the corresponding equitable wages. So the next slide, I'll be adding a little bit more information, and I'll be doing the same thing for the upcoming 3 or 4 slides so that you only see a little bit of information at once. So it's easier that way to assimilate the information. So here, what's been added are the 2 male comparators. So the maintenance workers at $16.75 an hour, which is the calculated equitable wage in New Brunswick, and the foreman, which would be $27.92. So it's important here to start with the male comparators because, as I mentioned before, it's based on the equitable wages for the male comparators that we can calculate the equitable wages for the female-dominated jobs. Here, once you have your equitable wages for the 2 male comparators, you can draw the fair wage line that we have here. And it's on this line that we'll be able to place all of the female-dominated jobs. So the way this graph works is you start with your horizontal line here, and I'll start with the maintenance worker. So in our job evaluation process, the maintenance workers obtained 388 points. So that would bring you to about here. And what you do after, you move on up until you reach the pay equity line. So this equates to $16.75 an hour in terms of an equitable wage. So the foreman here, when the committees did the job evaluation, the foreman received 745 points. So you would move on up here until you reach 745. And then again, you make your way towards the pay equity line, the fair wage line, and this equates to $27.92. So now we have a complete picture. And what's been added here are the female-dominated jobs. So they've been added along the fair wage line. So let's start with special care home workers. They received a total of 570 points. So if you go on your horizontal line here, you move on up to 570 points, and then you make your way up until you reach the fair wage line, which gives you 22 and 44. So here, family support adults and ESSP agencies, they both received the same amount of points, which was 639. So here, 639, again, same process. Here you would have about 639 points. You move on up until you reach the fair wage line, which gives you 24.60 for an equitable wage. And the last service, family support for children, they received the most amount of points of all the female-dominated jobs, and that is 681 points. So again, the same line here, you move on up until you reach 681 points. Then you make your way up until you reach the fair wage line, which is 25.91. That would be the corresponding equitable wage. Here in blue are the current entry level wage for all of the female dominated jobs. We looked at that in one of the previous tables. So it's just to show you visually the catch up that needs to be done in the sector to be able to reach this fair wage line. Here we have the same graph, but with the three other services. Now with these ones, I won't be going through the series of step-by-step graphs because the logic is the same. So you have home care workers, crisis interveners, and you have community residences, the care providers for adults and children. Okay, so now that you know our pay equity results, it's time to share our recommendations. So we at the Coalition, we do a lot of communication work, education work, but also advocacy, as I mentioned at the beginning of the presentation. And we have met with various government officials to share our recommendations with regards to our pay equity results. So these are our recommendations. First of all, we recommend a 5-year plan, whereas we encourage the government to make public investments in the sector to have better work conditions, better wages, and to eventually reach pay equity in the sector. Second thing that we recommend are wage scales. It's important to have wage scales for the sector because as someone gains experience and knowledge, they should move on up the wage scale. A third thing that we recommend is a pay equity maintenance process. As we know, jobs evolve with time, education requirements can change, even the clientele can change their needs. So it's important to do a pay equity maintenance process at the very minimum every 5 years, or if there are major changes. Another thing that we recommend is pay equity for all female-dominated jobs in the sector. So we looked at one job for each of the services, but we would ideally have looked at all the female-dominated jobs, like for example, cooks, administrative staff, and the supervisors that oversee the caregiving services, because they're all part of a female-dominated sector, and they're also undervalued and underpaid in most cases. So the second recommendation would be pay equity legislation for the entire private sector. Okay, so we're nearing the end of this presentation. For those who are interested, we did publish 2 pay equity reports, one in 2020 for these 3 services. So home care, transition houses, and community residences. And we published another one in 2021, in May actually, for 3 other services, special care homes, family support services, and ESSP agencies. And I'll add the links down in the comment section. If you'd like to get involved, I would invite you to join our discussion group on Facebook for the project and Be Caregiving Work Project. And you can also send me an email. Feel free to do so. And here is the website address for the Coalition for Pay Equity as well. You can also become a member. It's $20 for a lifetime membership and $10 for those who have more modest income. So this wraps up the presentation. I thank you very much for attending, for your interest, and we're continuing to strive towards pay equity in the caregiving sector. Thank you very much.